Hi. Did you know that if you have lungs, you can get lung cancer? That's all it takes. And if you do, you're probably going to get blamed for it. I'm Janine Cataldo. I'm an assistant professor at UCSF. I'm a lung cancer researcher. I'm an oncology nurse. And I'm also the daughter of two parents who in their first year of retirement died of lung cancer. So I understand the needs of patients, of families, and I also understand the challenges of clinicians. I've sat in waiting rooms and I've stared at dusty piles of brochures, and they've all got important information in them, but I've wondered there's got to be a better way to get this information to lung cancer patients. Because this information can help them navigate the healthcare system, which is not easy to navigate, and to manage their care. For the last 5 years, I have interviewed lung cancer patients and their families. We've heard from patients about the barriers that they experience in their clinic visits. They've told me about feeling rushed, about dealing with tired and irritable providers, not knowing how to ask those hard questions. Those hard questions like, how in the world am I going to pay for this? About what are my chances for survival? What are the best treatments? And when will I know to stop treatment? Patients describe feeling confused and scared and not understanding their symptoms or their treatment plans. But they also describe being determined and wanting to have all of the skills and all of the information they need to manage their care the best way that they can. They've described some conversations with providers felt to them blaming and judgmental. For the last 30 years, we've been trying to teach clinicians how to talk to patients, but that hasn't gotten us very far. So now I really believe what we need to do is teach patients how to communicate in the healthcare system that we have with their clinicians and providers. But how do you do that in an engaging and challenging way? That's the challenge. So I've watched young people, even young cancer patients, and they have access to some really engaging computer programs that educate them and inform them. And I thought, why can't we do that with lung cancer patients? So we've developed the mHealth TLC. It's mHealth Tool for Lung Cancer. It's a mobile game application that allows patients to navigate in a virtual clinic, a safe place where they can try new behaviors. And there they experience all of the barriers inherent in a real clinic visit. So their goal is to get through this clinic visit and to communicate with that virtual staff and get all of the information they need to manage their lung cancer care. Patients get to practice communication in difficult situations that include staff attitudes and stigmatizing situations. They get to confront feelings of fear, shame, self-blame, and anxiety, all feelings that lung cancer patients have told me that they deal with and cope with on a regular basis. They will collect health information, provide information on their symptom experience, and formulate questions they want to ask their real clinicians. When they complete this virtual experience, they will receive printed materials that they can put in their hand and take to their real clinic visits with the questions they want to ask and the information that they want to give. We are proposing an unconventional intervention to allow patients to change and practice new behaviors to improve communication. The tests of the early prototypes of mHealth TLC have been really successful. Patients, families, and clinicians have enthusiastically received it. They've given us really good feedback. We are so close, but we are not done. We're stalled, and we're stalled because of funding. As with any research, and especially with cutting-edge technology, we are faced with funding challenges. With disappearing research funds from the government, we have to find new ways to fund innovations in lung cancer care. We have received funding from the California Tobacco-Related Disease Research Program, and we've received funding from the UCSF School of Nursing. We're close to being able to test the effectiveness of mHealth TLC with patients in real clinics, but we still need refinement and development funds. This is where you can help. With your investment, we can conduct thorough usability tests, we can find what needs to be changed, we can change it, we can perfect it, and finalize it. Help us finish mHealth TLC. Help us empower lung cancer patients and families to get what they need to manage their care. Thanks.